afternoon, I am Vicky McCullum with the Wednesday edition of the Our City COVID-19 News Show. We will be updating you on the latest information and resources around the COVID-19 pandemic while unpacking deeper issues as they emerge. We encourage you to get in touch with us. We want to hear from you as we welcome contributions from movements, healthcare providers and our audience. We want this program to be a two-way flow of information, so please get in touch with us. On the show today, we speak to MMC for Community Health Services in the Western Cape, Dr. Zahid Badruddin, about some of the allegations made by the South African Human Rights Commission about what took place at the controversial Strandfontein homeless shelter. Paula Park residents say they have been waiting for a month to receive food parcels from social development and that there has been no clear communication as to what could be the holdup. Moving to the news. It is day 41 of the national lockdown, and the current number of confirmed COVID-19 cases nationally stands at 7,924, with 2,746 recoveries and 158 deaths. The Western Cape now stands at 3,677 confirmed cases of COVID-19, 997 recoveries and 70 deaths. Bacillus and BCG vaccine trials have been started at Tygerberg Hospital. 250 health workers were given the century-old tuberculosis vaccine in a trial to see whether the formula can protect against the coronavirus. A further 250 were administered the placebo. Adrius Diakon, founder of the clinical research organization TASK, said the BCG vaccine did something to the immune system that was not yet understood. The plan was to increase the trials in up to 3,000 healthcare workers in Cape Town as they were exposed to the virus the most. Participants will be observed for at least a year. One person in every 1,000 in 2 of Cape Town's 8 health sub-districts now have COVID-19. The Tygerberg area has 667 reported COVID-19 cases, while Khayelitsha has 474 infections. Cape Town has confirmed 3,246 cases of the virus, more than 88% of the total in the Western Cape. Premier Alan Winde said an additional 6 deaths had brought the provincial death toll to 70, and that flattening the curve required each and every citizen in the province to act responsibly in order to protect themselves and their loved ones. A fire broke out last night at the St. Patrick's Avenue informal settlement in Seawinds. The fire destroyed 3 structures and left 8 persons displaced.
The city's fire and rescue service received an emergency call at approximately 24 minutes after 10 yesterday evening of informal structures alight in St. Patrick's Avenue, Seawinds. A total of 5 firefighting appliances and a rescue vehicle were dispatched to the incident with a total of 21 staff members. 3 informal structures were destroyed, leaving 8 persons displaced and accounted for. No injuries were reported, and the fire was extinguished at 14 minutes after 11.
A beach demonstration in Muizenberg, held as part of the larger Back in the Water protest at beaches across the country yesterday, led to the arrest of 2 surfers for allegedly breaking disaster management regulations. The demonstration was organized by surfers in Durban. The 2 men, aged 52 and 65, were released on a warning and are expected to appear in court today. Workers at an abattoir for chickens outside Atlantis on the west coast have refused to go back to work after 2 colleagues tested positive for COVID-19. SABC News reported that about 50 workers sat outside the factory waiting for the health department to declare the area safe after it was sanitized over the weekend. A worker, Galen Stemmer, told the broadcaster that they wanted to be screened and tested. The CEO of the company, Bassie van Veek, said they had followed proper regulations and protocols. It's time for an ad break. We'll be back shortly. Welcome back. You're still watching the Our City COVID-19 show with me, Vicky McCullum. We will be giving you the latest updates on the COVID-19 pandemic and sharing essential resources and information with you. Residents living in Polo Park Informal Settlement, many of them unemployed in Gugulethu, have been waiting for more than 3 weeks to receive food parcels after they registered with the Social Development Department. They are pleading with the department to receive their supplies as they cannot afford to buy groceries for their families.
The Cape government has taken the initiative to supply food parcels to the destitute. As the country has been on lockdown for more than a month and many companies are unable to pay their employees, makes it difficult for one to put food on the table. But for the residents of Polo Park Informal Settlement, it seems that their food parcels are also on lockdown, as they have been waiting for more than a month to receive the relief.
Al die mense kry food parcels, maar ons wat hier in Polo Park kry die food parcels sien. Almal kry, hulle kry even give up for givers, hulle gee vir hulle almal baie mal vir hulle Vrydag uit te gee. Maar nie een mens het hier gekom en vir ons gevra ons al food parcels op goed gekry, ons het nog nooit niks gekry van niemand af nie. En SARS het vir ons gefoon, maar SARS het net ons gevra hoeveel kinders het ons en wat het ons, maar het nog nooit vir ons later gekom nie.
Ndingathanda yenzeka apha ePola Park oko sasibhalisile kafonelwa abantu kwa-social service but akafumani food parcel abantu basengxakini apha abantu balambile so into besingayithanda yenzeke at least abantu bafumane food parcel.
The residents say that they are suffering dearly during this lockdown as there is not enough food to feed everyone at home and they are unable to buy groceries for their families.
Hey, siyalamba kule lockdown ngoba kaloku bekubhetere ngela xesha uba abantwana babasesikolweni igrosari binoko igrosari bihlala ngoku kusetyenziswa ukutya and ngelinye ixesha uthi sowunayo ke ngonalo senti yabo uphinde kube nzima uba mawuyofikelela eshop hey siyabetheka yile nto yale lockdown.
The residents face many challenges here at Polo Park Informal Settlement as they have to share a few toilets and taps amongst each other. They say that their worst fear is contracting the virus.
Challenges esinazo apha ePola Park zininzi gqithi thina zininzi because yonke into ise-imess nje because thina apha ePola Park singachaphazeleka nanini na kule corona because sisherisha itoilet noba itoilet sisherisha siba 50 sisherisha itepu netepu noba sisherisha itepu siba more than 100 so thina asikho safe tu asikhuselekanga so sisengxakini nyanyani.
Ward Councillor Sonabo Nxumza says that there are two departments, which is SASSA and Social Development, that has taken the initiative to supply the residents with food parcels. He says that the residents did submit their list to both SASSA and Social Development, and they're busy sorting out the issue of food parcels.
We go two different departments. One is SASSA, and the second one is Social Development. Ilisi zabo banyanisile zasubmitwa ku SASSA no Social Development. Social Development have already given out in that information to e-service providers. But the information that I have is from yesterday. I was speaking with an official from Social Development is that they are busy selecting people. It's a huge list, but they are going to take few from Polo Park, few from Kiki, few from Lotus Park in different areas, I must say. Then this is what they are going to do moving forward. As a result, there are people that will be receiving food parcels at Kik, Lucas Mbembe Community Hall. But the reason why we are not extremely publicizing this, it is the responsibility of a service provider to phone individual that has been approved. Because remember, this process is also have to do with someone being approved.
For Our City News, I'm Zanele Mvana, Gugulethu.
Community Safety MEC Albert Fritz and MEC of Transports and Public Works Bonginkosi Madikizela visited the M5 roadblock to perform oversight over the movement of people between provinces and locally during the current 7-day grace period.
MEC of Transport Bonginkosi Matigizela and MEC of Community Safety Albert Fritz have come to the M5 roadblock to oversee the increase in vehicles during the 7-day grace period.
To make sure that people are complying with the regulations. Because since the announcement of level 4, there's been further announcement as well, especially the grace period that has been given to people from the 1st of May to the 7th of May. And we have noticed a number of cars on our roads, because that's resulted in an increase in a number of cars on our roads. Some people are taking advantage of this grace period, and they just decided to go anywhere. But I must say that I'm quite happy. What I saw this morning is that even though there were one or two people who are still, not complying with the regulations, but the majority of people are complying with the regulations. Many people that have stopped here, they have the necessary permits. Also, they are making sure that they are protecting themselves, they are wearing with the necessary PPE, and which is what we want to see.
As the 7-day grace period is coming to an end, the MEC of Community Safety, Albert Fritz, has warned against the movement of liquor.
At roadblocks is to look for any form of liquor distribution, liquor transport, companies transporting liquor, because that's banned completely. And so we will look for that, and the fine is very, very high. As we said, 15,000 rand for a fine, any form of violation of the liquor kind of regulations. And so I think that's a very important point. We have seen, of course, the economy. What I also see today, the economy is going, but it must go within the regulations. I think the one point is that liquor is at the moment not allowed at all. Distribution, transportation, and manufacturing. And we will continue to work with the liquor authority in the Western Cape, of which falls under our authority, to make sure that will happen, that no one transport, manufacture, or sell liquor in the province.
This particular roadblock has seen an increase in vehicles. Motorists are still encouraged to adhere to level 4 regulations after this grace period. Octavia Ndlovu for Our City News, Cape Town.
Following allegations of sexual assault, lack of access to healthcare facilities, and inadequate social distancing, the Strandfontein temporary shelter for the homeless has once again come under fire. This was after an independent report by the Human Rights Commission surfaced in the media, resulting in calls for its closure. We spoke to MACO Member for Health, Dr. Zahid Badruddin, for more on this.
Good day and welcome to the Our City COVID-19 show. Today I'm joined by MACO Member for Health, Councillor Zahid Badruddin, who will be talking to me a bit more about the Strandfontein temporary shelter. Welcome, Councillor, and thank you for joining us.
Thank you for having me.
So, Councillor, we know that the temporary shelter has been erected when South Africa went into lockdown, and it was an aid to help essential or let's say homeless people, help people cater to their needs. But ever since the start of the shelter being opened, we have seen allegations ranging from inadequate social distancing to sexual assault claims to even, a lack of healthcare services. But we've also seen that the Strandfontein Ratepayers Association has laid a complaint against the municipality. But what was the deciding factor for the closure of the Strandfontein shelter?
Yes, so the very same day that Strandfontein temporary emergency accommodation was opened, I myself said that this facility is going to close down. It has always been a temporary facility where we wanted to do three things. We wanted to be able to take our homeless people off the streets very quickly to a facility where we're able to screen them, do tests for those who qualify, and then also connect them to medical care. And so every single homeless person at Strandfontein was screened at least twice to date, and those choosing to leave will be screened for a third time to make sure that they're safe to go into the community. And we've also helped over 1,000 homeless people at the facility with either diagnosing new medical conditions or controlling already existing medical conditions. This is diabetes, cholesterol, high blood pressure, and also people have been diagnosed with TB that we've started treatment on and isolated them as needed. And so it's very unfair and and not truthful to suggest that we haven't done the necessary medical care at the facility, because we have daily a clinic functioning at Strandfontein, where we have nurses and doctors, and where we run a satellite clinic, if you will. And so it's not right to say that there's no medical care for them, because we have that. And also after hours, we work with the emergency medical services to make sure that people who need to access hospitals for very many things can do that. And so we make that happen. Notwithstanding the fact that there are people on the location now who are very grateful for the fact that they've been removed from traumatic circumstances on the streets where they are exposed to drugs. One lady, whom I wish I could share the video with you, is so positive about the fact that she's been clean from TIC for at least 3 weeks now because of the help that we've brought into the facility, medical, but also psychosocial. And so it's sad for me that when I hear stories in the media about what it is that we're not doing, it's sad because it's so untrue, and it's being said that this is these independent reports are exactly what's happening. The ratepayers who took us to court. The ratepayers took us to court on the basis that they were looking for an order from the court to close Strandfontein facility. And as I said, it's something that I said from the very beginning. Go look at my Facebook videos. You know, it wasn't a secret. And so I'm looking here next to me where the judge, the summary of the court proceedings on the day. And the judge, according to the summary here, I'm just going to read quickly from you.
Please, yes.
It says that the court was critical of the community's application in that, in effect, it sought to evict the homeless people from the shelter during the pandemic without even involving the homeless people as respondents. But more negligently, they didn't provide workable alternatives. And the court also then went on to say that in terms of the information we've presented through our lawyers, that the city has implemented, according to them and our application, sufficient evidence to show that we are making use of best practices as we've learned over time, and that we're implementing that. And then lastly, it goes on to say, that the Ratepayers Association was irresponsible to bring this kind of case to the court on an urgent basis. And so the court postponed the matter indefinitely with no further date, which means to say that they didn't see this as something urgent, as was being portrayed to them by the Ratepayers Association.
Talk about the Human Rights Commission's independent report. Was the findings unfounded? And what is your stance regarding this?
So I can't answer that question because I only got the report from them yesterday. And so it's very unfair. And I said this to Reverend Nisson on the radio a few days ago, that the only information we've got from their independent report is what we read in the newspapers. Yes. Now, I can't respond to piecemeal allegations against the city without them coming to me and allowing us to say what it is that we've done. So the document is quite long. I haven't yet been able to get through the bulk of it because it was sent to us so late. And the Human Rights Commission should have said, City of Cape Town, let's sit down, let's go through our findings, let's hear how you can improve. Because at the middle of all of this is our homeless people who are being used as soccer balls in a political agenda, and that's unfair to them. And so the Human Rights Commission doesn't keep in mind that the homeless people now have access to hot showers. They can shower when they want. They've got 3 to 4 meals a day, a daily clinic, and all the other services, the reintegration of at least 124 people at the camp that wanted to go back home. So we've got those successes, but no one was interested to ask us before they issued the report what our perspective was on this.
Dr. Badruddin now sheds light on what is next for the homeless since the shelter has been closed.
Say that at the middle of all of this is the homeless people, and they are in actual fact the ones that will be suffering the most. And to date, have you guys closed the temporary shelter? And what happens to the homeless people from here on out?
So the temporary shelter stopped to take people in from the 30th of April. From the 30th of April, no more homeless people will be let on site. Remember, it was a temporary site, and the city said at the very beginning that we were going to be opening up smaller accommodations across the city. One of them being the facility in Bellville, Plain City, where we have about 150 or so people at the moment. And so the facility doesn't take in any more people, and over the next 2 weeks, people will be removed from site to smaller facilities which are more manageable. And these are facilities where we're working with partners, NGOs, to help look after our homeless people. And again, that was always the plan, as I said from the very beginning. And no one seemed to believe me, unfortunately. But the city now is moving very quickly to implement that.
And on Friday, Councillor, there were reports that surfaced saying that people were still being denied access into the temporary shelter.
So please keep in mind that Strandfontein temporary emergency accommodation is a safe space at the moment. We know that there is no COVID-19 cases at Strandfontein because we've screened them, and those who needed tests got the tests, and those tests have come back negative. So we introduce risk into the camp when we allow people from the outside to come in who's been exposed to people who may potentially be asymptomatic with COVID-19. And so the regulations also say that very clearly, that there are certain facilities like shelters where entry is limited, access is limited for this reason. And so we now don't allow politicians inside. My own colleagues have to request permission because of the risk to the homeless people. And also we've become very cautious with allowing the monitors of the Human Rights Commission into the location, because they themselves are at a risk because of the people that they engage.
So true, Councillor, because we are essentially catering to the vulnerable and the most vulnerable of Cape Town, and that is the homeless people. But thank you so much for your time, Councillor. And there you have it, viewers of Cape Town TV. The Strandfontein temporary shelter has been closed since the 30th of April, and the people will be moved out as a phased approach. Thank you, Councillor, for your time, and have a very good day further.
When we come back, Octavia and Lovo will take a look at the latest on social media.
Welcome back. Before the ad break, we had Vicky McCullen with the latest news. Trevor Noah, here is South African-born comedian Trevor Noah with a message for you on COVID-19. This would be followed by a PSA from Health E-News on mask etiquette. Masks are now compulsory when going to public space, so you need to ensure that you are wearing and disposing of them correctly.
South Africa, my name is Trevor Noah, and I just wanted to say hello to you during this horrible, horrible time. Coronavirus has taken over the world, my friends. We're stuck in our houses. They've told us we can't go outside, and now we're stuck waiting for this 21 days to end. All over the world, we're going through the same thing, and all I can ask you as my fellow South Africans is to, guys, please, let's work together on this. Some people do need to go to work. Some people have to go outside, but let's make it safer for them by playing our part. You can stay at home. You can FaceTime with your friends, and you can braai indoors. Just don't burn down your mom's kitchen. Until that time is over, Let's do this thing and let's beat coronavirus. Stay safe, everybody.
Share your thoughts with us on Facebook, we're Our City CT, and on Twitter at Our City CT. These are the popular hashtags on Twitter today. Mboweni, the finance minister, has stressed that while there is an urgent need to reopen the economy, people's safety comes first, and the COVID-19 economic relief packages could not be distributed on the basis of race, as saving businesses and jobs was the priority. British American Tobacco, the giant tobacco company, has withdrawn its case against the government for going back on its decision to unban cigarettes. Now, BATSA has said it was willing to work with the government to find solutions rather than pursuing legal action. After the outbreak, we'll be crossing over to Vicky McCullen, who will share information on resources and places of safety that you can use during this period. Stay with us.
Welcome back. You're still tuned to Our City TV, the COVID-19 show, with me, Vicky McCullum. Before the ad break, Octavia and Lovo looked at what has the nation buzzing on social media platforms. For your latest news around the COVID-19 pandemic and to see what other Cape Townians are doing to keep safe, tune in to Cape Town TV Daily. These are some organizations helping communities stay safe during this period. That's all we have for you today, but if you have something to say, we want to hear from you. Send your comments, news and questions to us via Facebook at Our City CT, on Twitter at Our City CT, or get in touch with us via email on ourcity@capetowntv.org. You can also call us on 021 448 0448. From me, Vicky McCullum, and Octavia and Lovu, have a great day. Goodbye.